LIFiNG Podcast, Episode 12, Strength in Community, the Health Benefits of Volunteering. Welcome back to the LIFiNG Podcast, where small shifts create brighter living. I'm Dr. Violet Hunter, functional medicine and primary care physician, entrepreneur, wife to a retired military service member, and mom of 2 little ones who make life full in all the best ways. Each week, you'll get one simple, grounded, science-backed practice you can weave into your world, whether you're juggling family, building a business, supporting your community, or just trying to breathe a little easier. Today's episode feels special. It has officially been 3 months since I started this podcast. 3 months of conversations about small shifts. 3 months of grounded real-life wellness. 3 months of showing up consistently. And I am so grateful you're here. So today, I want to celebrate by talking about something bigger than any single habit: community. Specifically, the health benefits of volunteering. Why do I think that community is medicine? In functional medicine, we talk about nutrition, sleep, stress, movement, gut health. But there's another powerful pillar that often gets overlooked: connection. Human beings are wired for belonging. We regulate emotionally and physiologically through safe social interaction. Research shows that volunteering and community engagement can lower rates of depression, improve longevity, reduce blood pressure, increase life satisfaction, improve immune function, strengthen cognitive health as we age. But why? Because when we serve others, something shifts in our biology. Oxytocin rises, stress hormones lower, inflammatory markers can decrease, purpose increases, and purpose is protective. Here is the biology of contribution. When you volunteer, whether it's at a school, church, community center, military support event, food bank, or neighborhood initiative, your nervous system experiences something powerful: meaning, and meaning regulates stress. It reframes daily challenges. It expands perspective. It reduces isolation. Even one act of service can move someone out of rumination and into contribution, and that shift alone improves emotional resilience. Community service has been a part of my life for years, personally and professionally. Whether supporting military-related events with my husband, participating in community initiatives like Salvation Army, Americans for Independent Living, One City Momentum, or simply being present where help is needed, I've seen firsthand how service strengthens both individuals and families. It builds character in our children. It builds connections between neighbors, and it builds resilience inside us. And that's why I've made a decision to add this new initiative in my practice. I'm currently developing a process to encourage all of my patients to begin volunteering at least once a month, not as pressure, not as an obligation, but as a wellness intervention. We talk about prescriptions for exercise, prescriptions for sleep, prescriptions for nutrition. Why not a prescription for purpose? 1 hour a month, that's it. 1 hour that shifts attention outward. 1 hour that builds connection. 1 hour that strengthens community and personal health at the same time. Small shift, profound ripple effect. If you're thinking, I'm too busy, I understand. Life is full, but volunteering doesn't have to mean adding a major commitment. It can look like serving at a local event, supporting a school activity, visiting someone who is homebound, participating in a cleanup effort, helping at a food pantry, offering your professional skills for an hour. When service is intentional and realistic, it becomes sustainable. And sustainability is where health lives. As we celebrate 3 months of the LIFiNG podcast, I want to invite you into something bigger. Ask yourself, where could I serve once this month? Not daily, not weekly, once. See how it feels. Notice your mood, your sense of purpose, your energy, your connection. Because sometimes the shift we need isn't inward, it's outward. Thank you for being part of this community for the past 3 months. This podcast exists because you show up. Small shifts, brighter living, stronger together. I'm Dr. Violet Hunter, and I'll see you next week.